and welcome to Health Matters on Channels Television. Thanks for staying with us. I am Mary Alale Yusuf. The global figure for COVID-19 as at September the 4th was over 26.5 million. Recoveries were more than 17.7 million and deaths over 870,000. In the same time frame, 54,743 infections were recorded in Nigeria, out of which 42,816 have recovered and 1,051 died. The overall recovery rate was about 78%, while the death rate remains 1.9%. So far, 417,398 samples have been tested. In spite of now having 68 labs around the country, the Presidential Task Force on COVID-19 is reporting less testing. Nigeria is now the 5th worst hit African nation, having moved down below Ethiopia and ahead of Algeria. Let's look at the challenges affecting effective response to management of COVID-19 and the challenges of management in the outbreak. We will be talking with a public health physician from the Lagos State University Teaching Hospital, Dr. Fehintola Ganiyu. She'll be joining us by Skype. You're welcome to the show. So let's start. Yeah, you're welcome. Let's start now. Can you just quickly outline for us the new things in this new ease of lockdown, this third phase of ease of lockdown? What is new?
Okay, in this third phase of lockdown, we can see that the numbers are reducing drastically unlike before. That's why they went ahead in reducing, the lockdown. The curfew is now from 12 a.m. to 4 a.m. And we are seeing tertiary institutions about to open. They've seen that even the cinema can open to 50%, capacity. We are hoping that after monitoring things that has been happening, we won't have a rebound of the numbers. We won't have a rebound of the COVID-19 exposures than what we are currently experiencing now. So because if we do that and have numbers that are higher than expected, it's more likely that it might lead to another lockdown if not being careful. But for example, we're still admonishing people that as these parts are opening, the cinemas, the universities, the tertiary institutions, they should still adhere to the precautionary measures. Your face mask is very, very important. Use of your alcohol-based hand sanitizer. You wash your hand with running water for at least 20 seconds. If all those steps are being put in place, we can say that, okay, it is safe for this third ease lockdown to go ahead without any complaint or without any rebound of the numbers that we're expecting. Yeah.
Okay, now the PTF is saying there's apathy when it comes to testing. They have a capacity to test 15,000 samples daily. But as at the last count, it was just over 4,100 samples that were tested. What can be done to increase testing? Or are people being caged by the criteria for testing, fever and all that stuff? What can be done to increase testing?
Well, for the testing right now, the what we know is that they are increased testing centers to all like in the local government areas. In different local government areas, we have places where you can go to test aside from the IDH to increase the numbers of samples that we're taking, the number of samples or numbers that we get. But another thing again is people not really wanting to be tested. You have fever, you have this, you have that. They don't like the way they are being treated. They don't like the crowd they see when they go there. So in covering that area, I think another thing that we have to tell them know that it's for their own good. The fact that even if you test positive doesn't mean that you're going to be, put aside and be be treated anyhow or be treated somehow. So if we can tell them that it's just for their own good, and aside from moving the local government, I don't even think people know that it's present in each local government area. If we can also sensitize them and allow them know that it's present in each local government area. I mean, we have over 20 local governments in Lagos State, for example. We have Ikeja, we have Shomolu, we have Ikorodu. As much as it is close to their area, they should be able to go there without much crowd than everybody going all the way to Yaba to get tested. So increasing also that, then I think some centers also have also been given permission to be able to be tested. Some private hospitals, some private hospitals also be given permission for them to be tested. So if we can allow people, can sensitize the public to know that they can go into different of the local government for them to be testing, and it's not going to take time as much as they think it's going to be, then I think the numbers would have greater numbers. Yeah, thank you.
With this third phase of ease of lockdown, do you have fears that things might get complicated if this testing pool is not mopped up?
Well, it's a 50-50 thing. Yes, possible it may skyrocket up, and possible we may just be experiencing the same numbers we are having now. For example, this third phase of ease of lockdown, the areas they say they should open up, like the cinemas, the tertiary institutions and all. Tertiary institutions and the secondary schools. Secondary schools, we cannot really monitor them. Unlike tertiary institutions, they're adults. So if you tell them wash your hand, they wash their hand. If you tell them maintain a distance of 1 meter, they maintain a distance of 1 meter. It's possible for them to adhere to the rules. And the major thing in trying to bring down this number is letting it be controlled at the community. If we have it controlled at the community level, everybody keep still wearing their face masks. Wearing the face mask as a result of preventing the germs from coming out. So if the germs are not coming out, the amount of viral load in the atmosphere is going to be reduced to a minimum number. So even these children that are going to school, for example, them is the secondary school students or primary school students that are going to school, would not have so much in the atmosphere for them to take in in order to transmit even to the elderly ones when they get back home. So if we can do that and keep the community level at the barest minimum, there's likelihood that the number would not shoot up. But if at the end of the community level is not being maintained and we cannot control the community level, and the virus is just up and down, the students are carrying it to the houses, to their elderly ones, the numbers, then you see that the numbers keep on increasing.
That's where I have a concern. You spoke about students bringing it back home. Now in America, they're advocating that any student who gets it should be kept in school. What is the plan for us in Nigeria? Are they going to be sent home, isolated at home, or are they going to be taken from the school to isolation centers? Bearing in mind that there are so many secondary schools around the country, what is being put in place?
Yeah. Well, for the secondary schools, I don't think we are not advocating for them to be kept in school. No, because if they're kept in school, the school don't have the capacity, to treat or isolate these ones. And their friends can easily go into the sick bay and say, "I want to see my friend. I want to see my friend." Before you know it, that one removes his mask and.
Hello, are you still there?
The symptoms, fever, sore throat. Yes, I'm here. Can you hear me?
Go ahead, yes.
Hello?
We can hear you.
So if any of the children come down with fever, yes, with any of the likes, it's likelihood they tell them to go back home. So the parents and the school get in touch with the COVID response team. I think the COVID response team are the ones that are going to take it up from there, either to isolate them at the center or they have a special place where they're going to keep children for this purpose. Because I think for them allowing schools to resume, they're also putting in place what is going to be done and where the children are going to be kept, because the children can't be kept at home. Their caregivers are their parents. Parents can easily, this is a child, and it's a blood. It's your blood. You won't want to treat the person, segregate the person anyhow. You still want to give best best bet as much as possible. They might not even use their face mask as appropriate. So I think the response, or the first thing, is to try to get to the COVID response team. The COVID response team will take it up from there in having separate places where children are kept, so that it's referred to anyone.
Okay, in other climes, people are concerned about the interaction between the flu and COVID-19. Should we be concerned about any disease interactions here in Nigeria?
In Nigeria, compared to the United States, or areas in the cold region, they have all this flu, they have the influenza disease, but here in Nigeria, it's not really rampant. So we wouldn't say we should be worried about disease interaction. And it's just once in a while we have this shoot up of pandemic diseases, but currently right now, I don't think there's anything we should be worried about disease interaction. We don't really have the influenza much here in our own country. So let's even first tackle this COVID-19 that we have now, but we shouldn't be worried about disease interaction.
But with the rains, sometimes there's a rise of cholera. Could that be a complication?
Well, it's more of a waterborne disease, food disease, where you have it's not an airborne disease. So the rain won't have anything to do with cholera. Something you eat when you get infected, either from food, either from water. Cholera on its own is a different entity. It does not have to do with cholera separately. Okay. You have COVID and you tested positive, but I don't think it's just going to affect your immune system. Fine, and any disease that affects your immune system will make you more susceptible.
Okay, now I want to talk a bit about masks.
Even any other disease apart from cholera.
Okay, sorry I caught you there. Yes. I didn't know you were still talking. I want to talk about masks now. Recently, they are now saying that you wear a mask to protect yourself as well. In the beginning, it was wear a mask, don't be selfish, protect the next person. Now it is wear a mask, protect the next person, also protect yourself. Can you explain that?
Okay, wearing a mask, for example, the major thing of wearing a mask doesn't mean you can't come down with COVID-19. But wearing a mask majorly prevents you from spreading the disease outside. But even also, it gives some percentage of protection for yourself. So that's where the statement comes from: wearing a mask protects your next neighbor.
Dr. Ganiyu, we are going to have to continue that. I'm so sorry to cut in. We're going to have to continue that after the break. We're going on a short break right now. Please stay with us. Welcome back. This is Channels Television and it's Health Matters. To get your questions answered about COVID-19 on the program, the number to call is 0808 054 2233. You will see the number on your screen, and you can also tweet at CTV_Mary A. While we continue with the conversation, Dr. Fehintola Ganiyu is on Skype, and she's talking about how masks protect you. Dr. Ganiyu, please continue. Okay, so while we wait for her, in the beginning, we were told, wear a mask. Wear a mask for the sake of the other person. Do not be selfish, so that when you sneeze or when you cough, the particles stay within your space and don't spread around. Also, when you cough or sneeze without a mask, even though nobody is around, the particles spread and land on surfaces. And an unsuspecting person can go there, touch, and in the process of touching the face, receive or contract the disease. But now we are being told, when you wear a mask, you can also protect yourself. Now, there are different types of masks. Some have multiple layers and some have a single layer. Some are made of cloth and some other material, I don't know. So we would like to find out the efficacy, the effectiveness of some of those masks. Let's also quickly remind ourselves of the numbers that we've been seeing in the country. So far, the numbers have been reducing in Nigeria. There's been a lot of rejoicing, people talking about us flattening the curve and all that. But we've been told it's too early to rejoice. It's too early to roll out the drums. Testing has not been enough. Nigeria has 68 labs, according to NCDC, spread all across the country, and they have the capacity to test 15,000 samples every day. Yet, just yesterday, the tests were 4,130 about, not even close. So they are appealing to people, come out and get tested. If you have a fever or any of the symptoms, come out and get tested so that we can use this capacity. So let's go back to Dr. Ganiyu, who is now on phone, and she's talking to us about how masks, she's on phone, and we're talking about how masks protect you. Okay, I understand we're getting a phone call. Hello? What's your question?
Hello? 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 Hello?
The voice is there.
My question is why is it that you media people, you don't use this mark? My name is Pastor Babatunde Olagunle from Atoshi.
Okay, thank you, Babatunde. I will not pass that on to Dr. Ganiyu because you're talking to us directly. Okay, so I'm not using a mask because I'm on air. We do our social distancing here and we also clean up. It's just so that you recognize me when I'm on TV and I'm not all covered up. But trust me, we wear our masks. All right, so do we have Dr. Ganiyu on the line? All right, so Dr. Ganiyu, now that you're back with us on Skype, let's continue talking about the masks and how they protect the person wearing them. Okay, we understand that is being taken care of. There's been a bit of trouble with the internet, a bit of trouble with the airwaves. But is she back? Are you back now? So while we wait for Dr. Ganiyu, we were talking about the numbers. Hello, Dr. Ganiyu, are you there? Let's talk about how masks protect us, the wearer.
Okay. Wear a mask protect the next person, wear a mask protect yourself. When you protect the next person, when you cough or sneeze, it doesn't go out to affect your neighbor. Then also, in contacting the COVID-19 disease. So if you wear a mask, you have lesser chances of contacting than not even wearing a mask at all. We're not saying even that mask, it doesn't offer total, protection, but at least it still covers some form of protection to yourself and also majorly to the next person beside you. Basically, that's the mask. Then we have different forms of masks. I don't know if you want me to talk about that.
Okay, we hardly have that much time, but let me quickly ask, why is the emphasis on wearing a mask and making sure it goes below your chin? Why do they ask you to wear it that way?
When you wear a mask, you're trying to protect both your nose and your mouth. So let's use the surgical mask, for example. If you look at the surgical mask, it has like a ring form. The ring form on top is supposed to be on the bridge of your nose. You press it down and that stays on the bridge on your nose. then you're supposed to draw it down to cover your chin, because we are talking of airborne particles. They can, if it's not covering your chin there, they can find their way under your chin into the mouth. So if it doesn't do that, then what are you now covering, or what are you now protecting? So it's trying to make sure that it covers your chin, because some particles can find their way below your chin and enter into your mouth and even into the nose from below. So we are trying to make sure that it covers the chin so that nothing goes from below, and also let it reach the bridge of your nose so that nothing goes in from on top also. So that's why we are saying that it doesn't cover the chin down.
Now,
it can find
let me quickly ask you. Let me quickly ask you. In the scheme of things, among the non-pharmaceutical interventions, how high do you rank social distancing? Because I notice our people do not like to distance themselves. How high do you rank it as a preventive measure?
Yeah, as a preventive measure, I'll give it about 80% on a scale of 100. 80%. Because the virus, it can't travel a far distance. And that's why we keep on preaching social distancing, social distancing, social distancing. If you cannot adhere to social distance, then that's where it comes into play. You're in a market and you want to buy something, two of you are trying to price an item. There's no 1 meter distance between both parties. So if you are wearing a mask, the mask cannot come into play and offer some form of protection. So social distancing is a good form of preventive measure. Give it about 80%, and if it can be done, it goes a long way in preventing the virus from spread from one person to the other. The fact that you are in the house and you are not wearing a face mask because you're not sitting so close to the next person beside you, or the fact that you are, the social distance is a good one. Then with the mask and confer some form of protection. So it's really a good measure.
Okay, let's quickly take this call. Okay, I understand we've lost the call. Thank you so much for being with us. It's been quite a program. She got stuck in traffic. Thank you so much, Dr. Ganiyu, for how long you persevered. I do appreciate it. And thank you everyone at home for watching. Let's do it again next week. But before then, please go to channelstv.com/podcasts for an audio version of this program. Stay safe, and we'll see you next week. I am Mary Alale Yusuf.